Hi, I'm Dr. Biff Kramer from Orlando, Florida, and I'm here today to talk to you about the PRN, or the Physicians Recovery Network. Probably in order to talk about the PRN, I need to tell you a little bit about myself first so you'll understand what this is all about and why we're taking your time today to give you this presentation. I graduated probably before most of you were born from the New York College of Podiatric Medicine, where I went to school from 1963 to 1967. I was one of those students who was the president of my class, president of the student body, graduated second in my class, graduated cum laude with many honors and awards, went on to become one of the youngest members of the executive committee of the New York County Podiatry Society, and served in many capacities there, was also the president-elect of the Florida Podiatric Medical Association when I moved to Florida. What you're listening to is the curriculum vitae of a using drug addict. Yes, that's right, a using drug addict. What this teaches us is several things. One is our concept of what a drug addict is and what drug addiction is skewed terribly by the media and by our lack of understanding. Drug addicts can come in all sizes, shapes, and forms, and they can be extremely functional during most of their active addiction. The case for me was that I went on to do an internship and residency at Beth Israel and practiced for 13 years well before I got clean. Why did I get clean? What happened? Well, that's where the PRN starts to come into effect. And what happened to me was that I was what everybody thought they'd want to be when they grew up. I had the respect of my peers. I had the wife, the two children, the imported car, the nice house, the dog, the practice, everything you could think you would want, and I was dying on the inside. Finally, what happened was that an intervention was done on me, and back in 1980 when I got clean, interventions were not the normal run-of-the-mill type of situation. We didn't know very much about the disease of addiction or what to do with it at that particular point. However, an intervention was done on me, and then I went on into recovery. I went to a treatment center that was designed for physicians in Atlanta, Georgia. I spent 5 months there between primary treatment and a halfway house, and then came back and got back involved with the Podiatric Medical Association. What this kind of leads me to is a little bit of a discussion of the disease so that you'll understand exactly what was involved in the whole scenario. The disease of addiction was first classified in the 1950s by the AMA as a disease. It encompasses addiction to any mind or mood-altering substance, including alcohol. It is different from any other disease in the fact it's the only disease where the patient must make the diagnosis before any kind of recovery can begin. It's a family-oriented disease, and it affects not only the using addict but everybody around him. When I first started doing these presentations back in the early 1980s, the statistics of the National Institute on Alcohol and Drug Abuse said 1 out of every 10 Americans would be addicted sometime in their lifetime. What we've come to understand today is that the statistics have changed dramatically, and we're now at a point where a full 20% of the American population will be addicted sometime in the course of their lifetime. That's 1 out of 5. If you take that into account and the fact that it's a family disease and it affects everybody that comes in contact with the using addict, none of us will go through our lives without being affected by the disease of addiction. Healthcare providers seem to be 400 times more prone to the disease of addiction than the normal population. Well, why is that? Well, I have a feeling it has to do with the type of people that go into rendering healthcare in the first place. If you took the MMPI of a healthcare provider and the MMPI of a drug addict and shuffled them all up and gave them to a qualified psychologist, he would be hard-pressed to tell you which profile went with which particular person. What I'm saying is that the personality of a healthcare provider and the personality of a drug addict are identical. And therefore, the predisposition for healthcare providers to be prone for the disease of addiction is based on what we've come to know as the addictive personality. Well, what is the addictive personality? Best summed up, it's an egomaniac with an inferiority complex. We're other directed people who seem to need approval from the outside. We tend to be overachievers. We tend to be in the upper 10% of everything we do. We tend to be perfectionists. We tend to drive ourselves relentlessly, and enough is never enough, and we're never good enough, smart enough, young enough, or pretty enough to do what we want to do. All this being said, these seem to be the same type of people who choose to provide health care. We also feel that we have to go outside of ourselves to be able to feel good, and being able to render a service to somebody else seems to be necessary for that. The good news is that 1 out of every 10 of the normal population, or 10% of the normal population, who does self-diagnose themselves with this disease of addiction seems to have any kind of long-term recovery. In the case of healthcare providers, the table is skewed a lot more in our favor, and the reality is about 80% of those people who are healthcare providers who begin to have some type of recovery process seem to have long-term recovery, and the recovery does seem to extend for 5 years or more. Well, why is this? One of the reasons is we have a whole lot more to lose, and therefore we seem to have a lot more of an opportunity to be forced to recover from this disease. Our license is usually in the hands of a regulatory authority who might put some restrictions on us. What is the PRN? It's a standing committee of the APMA. It's appointed by the President on an annual basis. The members are composed of both DPMs and some non-DPMs, students, and even podiatric medical assistants. Any member of the podiatric medical family that the President chooses to appoint and who is willing to serve on this committee can be a member. Not everyone on the committee is a recovering drug addict. I need to say that again. Not everyone on the committee is a recovering drug addict. These are people who have an interest in helping people recover from the disease of addiction. In the last 20 years, this committee has become much more visible. It is called a Physician Recovery Network, which more clearly states what it is, and its role primarily is to either restore or preserve our roles in the healthcare community. The trained and educated mind is even more of a terrible thing to waste, and so the preservation of that training and education while still protecting the public is the primary goal of the PRN. One of the ways that we do this is through peer consultation and counseling, as well as support. First, let me go back and say that all contact with the PRN is completely confidential. It is not a regulatory agency. There is no responsibility or requirement for the PRN committee to keep records or to forward any information it receives to anybody under any conditions. Therefore, all contact with the PRN subcommittee is confidential, and the confidentiality is maintained at all times. It works through an 800 number, which is 800-488-4767. The number is published in the journals. It's published throughout the profession, and I'm sure it will be given in your orientation package as well. And we do deal with other issues as well, although the primary focus is on recovery from drug addiction. We've dealt with physical impairments, recovery from severe injuries that may limit their physical ability to utilize a hand. We've dealt with cardiac patients recovering from open heart surgery, wanting to go back into practice. We've even dealt with other family issues, marital problems, and other types of addiction like gambling, sexual addiction, credit card addictions, every type of addiction you can think of. However, the main focus does appear to be on drug addiction. If you have a friend or somebody who you think may have a problem and you wish to know how to proceed with handling these people, the PRN would be the people to contact for this as well. What this is and what PRN is part of the APMA's commitment to support all of its members. It's a way of APMA reaching out to the podiatric medical family and offering a much-needed service to the healthcare providers. My experience is that when I most needed the APMA, when I was beginning to recover from this disease of addiction, they were there. My peers supported me without question. My peers were there for me no matter what, and the APMA maintains that position today. PRN is there so that if you're having a problem as a student dealing with the stresses of studying, school, any other situation you're in, and if you find that you may be partying too hard, drinking too much, let us know.